Good afternoon, everyone. Welcome to the December 2nd edition of the biweekly COVID-19 situational report for our community. So pleased to have you join us today. And as we noted, this is a very special day as the public debut of Dr. Thomas Pigott, our new Medical Officer of Health for Peterborough Public Health. My name again is Brittany Cadence, the Communications Manager for Peterborough Public Health. And before we get underway, I would just like to start us off with a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So as we noted off the top, today we have the great privilege of welcoming Dr. Pigott as our new Medical Officer of Health, and he's joining us for the first time for these briefings. And before we begin with the COVID-19 update, and to mark this occasion, we have several local leaders on the call with us today who have asked to share a few welcoming remarks for Dr. Pigott. So let's begin with Chief Emily Wheatung, who's joining us from Curve Lake First Nation. So over to you, Chief Wheatung.
Can you hear me?
Yes, we can hear you.
Perfect. I have to have a combination of phone and computer here. So, I'm really grateful to be able to welcome Dr. Pigott to the traditional territory of the Mississauga. And thank you for the land acknowledgement. I'm thrilled to be able to share with everybody, and in particular Dr. Pigott, that the traditional territory of the Mississauga is a really, really wonderful place. I think you'll find that we have a beautiful area to welcome you to, but I also want to share what it means to welcome you to the traditional territory of our people. My grandfather would have been 100 on November 30th, and he passed away earlier this year, and he's very missed, but he would sit by the lake with my sons and my father and I, and he would tell us the stories of his grandparents, and he would tell us the stories that his grandparents told of their grandparents. And so when we recognize our territory and we welcome people to our territory, we're welcoming you to the space that our ancestors have occupied for as many generations as our stories can contain and can remember. And so we're really looking forward to introducing Dr. Pigott to the whole territory, and we're really excited to have that medical expertise here in our community. So welcome to the territory, Dr. Pigott, welcome to our community, and we're really looking forward to working with you. Chimigwach.
Thank you so much, Chief Wheatung. Wonderful that you could join us today. Thanks so much. I'd like now to invite Chief Lori Carr from Hiawatha First Nation to say a few words.
Ani bojo wowash kesh dodem, megaze kwe dishnakas, Lori Jaganash Noswin, Mississauga, Anishinaabe, and Dow. Good afternoon, Dr. Pigott. My English name's Lori. My Indigenous name is Eagle Woman, and I am chief of our community of Hiawatha, and my clan is the Hoof Clan. And again, as Chief Emily had noted, welcome to our traditional territory and Treaty 20 and Williams Treaty lands. We do have a long, rich, beautiful history here, and we welcome you to this territory and your family and your children. I understand you have a new baby too, so congratulations on that and on your new baby, and welcome your family here. It is, as Emily had noted, Chief Emily, it is a beautiful area, and We look forward to having you here, to having you as our new medical officer of health and building those great positive relationships and learning more about our, not just the area itself, but our specific First Nations and the health concerns that we have and how we work together to address not just COVID, but all those what brings us to be healthy communities and healthy people. So we look forward to that and look forward to meeting you in person later today. So miigwech, thank you.
Thank you so much, Chief Carr, and wonderful to have you joining us today. Okay, so now joining us all the way from the county of Peterborough, we also have Warden J. Murray Jones, who I believe has a few words to share. So please go ahead, Warden Jones.
Okay, I trust everyone can hear me okay. And it's my real honor to say welcome to Peterborough County. We have a big place out there that we call the county with the city in the middle of it. And you know, I've often said more than once that we're all in this together. And when we look at 30,000 feet down on our little area, it's a little tiny dot. And it's up to all of us to make sure that that dot stays the way it is and doesn't get harmed. So I just want to welcome you. I certainly think that Peterborough County got a little bit better because you're on the job now. We are here to help you in any way we can. Peterborough County are our partners in the whole health issue, and we want to stay that way. And we're here to help in any way we can. We have 8 municipalities that make up Peterborough County, and as I said, we're all in this together. We've got your back, and I know you've got our back, and we're here to help in any way we can. And I look forward to meeting you. I believe next week you're going to have the thrill of coming into the county courthouse, but for good reasons. So, Dr. Piggott, welcome. We're glad to have you, and we're here to help you. Thanks.
That was great. Thank you very, very much, Warden Jones. And I do expect we'll hear from Mayor Diantarian a little later in the call when she's able to join us. Thank you all to our local leaders for joining us and for those kind words welcome. So without further ado, let's get back to our regular program, and we will open it up to our board chair, Mayor Andy Mitchell, to share some initial remarks. Please go ahead, Mayor Mitchell.
Well, thank you, Brittany. And I too would like to take the opportunity to welcome Dr. Piggott to Peterborough Public Health and more broadly to the city and county of Peterborough. It is great to have him join us, and on behalf of the board, to say how much we are looking forward to working with him. As was noted, during the next few weeks, Thomas will be reaching out to the community, learning about our priorities and issues, and addressing the public health challenges we face as a region. The past 2 weeks has seen both promising as well as concerning news. On the plus side, local vaccination rates continue to rise. 87.6% of eligible individuals have at least one dose and 85.1% have two. And we are now also reporting 5.4% of folks of having had a third dose. And we have also begun to immunize children aged 5 to 11, and the take-up has been good. And just today, we learned that 90% of Ontarians 12 and over have received at least one dose. On the downside, however, case counts across the province have once again begun to rise. Locally, case counts have also risen to more significant levels, and it now appears a new variant, Omicron, is circulating in Canada and around the world. This is a time to be prudent, not panicked. A time to do research, not to speculate. The time to continue the public health approaches which have proved successful over the past 21 months, not a time to let our guard down. As we face more uncertainty, please continue to take actions that protect yourself, your family, and your community. If you are eligible, please get vaccinated. Where required, please continue to wear a mask. When possible, consider avoiding large crowds. Remember, practice good hand hygiene, and if you feel ill, stay home and get tested. Together, we have made good progress protecting our community these past months, and together we will continue to do so. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very, very much, Mayor Mitchell. Okay, so now we will turn it over to Dr. Pigott to walk us through these next few slides and explain where we stand from a data perspective. Please go ahead, Dr. Pigott.
Thank you, Brittany. I'll start with a situational update and then get to some remarks. I'm still very much learning, and so we have a great team of people, individuals who, such as Donna and Larry and much of the management team, have done a phenomenal job of holding the ship steady through the last few months until I arrived here yesterday, and deeply grateful they're here and joining. Before I go through our situational update as well, I just want to take the moment to express sincere gratitude for the words of welcome from our board chair, from Mayor Mitchell, from those other individuals, dignitaries who joined us today. So thank you so much, Chief Weetung, Chief Carr, Warden Jones. I really do appreciate that welcome. And so far, I've just found the community to be so welcoming and kind. And I'm very much looking forward to, in particular this week, getting to visit and get to know and start the process and journey of listening and learning, which I imagine will take years, not days, with our Indigenous partners, with the 2 First Nations we serve in this region. And it's a real privilege to be able to do that and to be able to work with both of you, Chief Weetung and Chief Carr. So looking at our situational update now, we have 45 active cases in the region, which has resulted in 304 close contacts. This is concerning because our high-risk contacts continue to increase substantially. And this is twice as many cases, active cases, as we had 2 weeks ago when we reported 21 cases. And it's almost 3 times as many contacts. What is concerning as well is many local elementary school cases where the majority of students are unvaccinated to this point. And we'll get to talking about the vaccination and the importance of the vaccine for that group, because we are seeing many of our cases coming from that. While our community fortunately has not seen an increase in the number of deaths due to COVID-19, I'd like to acknowledge the sad milestone that the province reached this past week, which is that we surpassed 10,000 deaths due to COVID-19 since the beginning of the pandemic. And I do just want to take a moment to offer our condolences to the families who have suffered so greatly from this virus. And I hope that we can all take some resolve from this to continue doing what we need to do to stop COVID-19 from spreading and to stop it from causing such disruption and loss. This graph here helps to compare case counts by week. And you can see here an increase from 21 to 30 to 43 in the last three weeks. And we are set to potentially surpass that as well this week with already 12 cases so far as of reporting yesterday. When we look at the data by age group on the next slide there, Brittany, you can see the breakdown of cases in the past month. Youth under 20 years old in particular continue to represent a high proportion of cases. So it's interesting to note that the number of cases essentially mirrors the vaccination rates for each of those age bands, evidence that the vaccine is working, even if it has not been perfect in preventing cases. What we are also seeing is decreased severity with people who do have a breakthrough case if they have been fully vaccinated. Next slide, Brittany. Here we can see that there are currently 2 active outbreaks in the community. 7 of the last 9 outbreaks we've had since October 1st have been in schools. 6 of them have been in elementary schools, and a new one we just declared yesterday at Holy Cross Catholic Secondary School. There are presently cases in 10 schools in our region, and it's important to note that not all cases were attending school when identified as a positive case, but these are still reported by the Ministry of Education. On the next slide, we can see a map that compares case rates for health unit areas, and you can see the weekly case incidence rate for Peterborough region, and it is slightly below the Ontario rate at this point. But you can see how looking across the province, the 4th wave continued case spread is intensifying in other parts of the province, in some of our neighboring health units, but especially in Northern Ontario now at this time. And we can see a dramatic difference even in the past month looking at case counts in Ontario by health unit, and the intensification of cases is obviously deeply concerning, and should serve as a cautionary note to limit travel to other parts of this province, even when it is discretionary or unnecessary travel. This next graph shows our wastewater surveillance, and you can see for Lakefield, Millbrook, and Peterborough. And what we can see is that over the past several weeks, there have been increases in the signal in Peterborough system, and a slightly lower signal in Millbrook. And the earlier detections we had in Lakefield have seemed to have dropped off. But again, there are limitations to this data, and we'll continue to monitor this as one piece of information very closely. Flipping along to the next slide, we have our vaccination coverage, which our board chair had spoken to. But here is our current vaccination coverage as of the end of yesterday's clinics. Lots of good news to share. Overall, those 12 years and older, vaccination rates stand at 85%. Still lots of progress. You know, I don't think an A- is a good grade in vaccination coverage. We should be striving for an A+ and closer to 100%. But that means there is certainly much room to go here. 3rd dose uptake is improving. If you look at the orange graph here on the right, you'll see that just over 15% of adults 70 years of age and older have received a 3rd dose. If we look at our youth rates on the left, you can see now that 83.2% of 12 to 17-year-olds have received both doses, and this is a good increase from 2 weeks ago, approximately 1%. Our tracker will be updated soon to reflect 5 to 11-year-old vaccinations as well. But I can share that as of the Tuesday evening clinic, we vaccinated nearly 300 children, and 2,300 are booked in for their 1st dose already. So we're making good progress, and we'll have done a lot of vaccination in this really important age group in the period leading up to the holidays. And if we go on to the next slide, I just want to take the opportunity to remind you of our link, peterboropublichealth.ca/clinics, for information on vaccine clinics. We do have a variety of clinics available, both for the 5 to 11s and for ages 12 plus and boosters. And the next slide shows the continued schedule up until the 18th of December. So I do encourage you to take a look at our website and book in if you are eligible and if you haven't received your vaccination so far. I'm going to move along to some general remarks, which I'll keep brief today because I think this week for me is largely one of listening and learning and meeting people from our wonderful region here. I've already started and hit the ground running with lots of meetings yesterday, and am very much looking forward to continuing at full tilt so that we can start and continue all of the good work in public health that Peterborough Public Health has been doing. There's 3 things in particular I want to highlight today, and then we'll obviously be happy to take any questions from the media. The first concern is the Omicron variant, and a bit of information about transmission, emerging evidence on transmission and how important the spread via an airborne transmission route is to this pandemic. I'm then going to talk a bit about the upcoming holidays and some potential concerns, but also our plan to get messaging out to help you with decision making as you're approaching the holidays and all of the potential festivities we'd usually come to expect around this time of year. And I'm going to close with some words on our staff and the continued dedication, but also the importance of their well-being and protection through their continued response in the pandemic. So to begin with Omicron variant, as I'm sure many people have read in the news, there are certainly more questions than answers at this point. The variant was first announced by South Africa only last week, and continued assessment has now found the variant in many parts of the world, a majority of countries, including cases in the Canadian context, including cases in our very province in Ontario. There is some signal that there was potentially cases of this variant in Europe prior to its arrival and announcement in South Africa. And this could potentially explain the surge that Europe experienced with cases going from only 8,000 cases a day to 40,000 cases a day in October. This is all still at this point speculation, and information is continuing to come out. I expect many more countries and provinces will announce cases of this variant in the coming weeks. One of the first questions that remains unanswered is exactly how effective our current vaccine will be against this Omicron variant.
Is now exiting.
Testing is actively underway by the vaccine manufacturers and by countries who have detected the variant to better understand how much protection these existing vaccines will provide. Will they be fully protective? Will there be concerns of potential vaccine escape and the need to potentially pivot and offer other adapted vaccines into the future? These are not questions we know yet at this time. It is time for prudence and following guidance, as our board chair has suggested. It's not time for panic, but we and I are watching the situation extremely closely. With regards to our local response to Omicron, I think what is important is to assume and behave as if this variant is already in our region. It certainly is in our province, and the coming days will help us to better understand its distribution across the province. But if there's a silver lining in this, I think it's that we're hearing about this at the end of November and early December, before the holidays and before we have a number of gatherings. Had this information come to light only a few weeks later, the consequences could be much more dire and much more concerning. And so we will continue to monitor the situation closely using an evidence-based approach, following provincial and federal guidance, but taking the local context into consideration as we strive to both minimize the interruption and social disruption to life, but also take on the very important task of protecting the population's health. What does that mean for the holidays? We do not yet know what this variant will mean for the holidays, but I do want to say early that it may not be the holidays we're hoping for. It may not be like the holidays of 2019 in those days before the pandemic. And I think that people should be beginning to think about this accordingly and to start thinking about measures to protect their family and safety throughout the holidays. What is important to consider as part of this is that we do know now there is Public Health Agency of Canada and WHO updated guidelines reflecting the importance that airborne transmission plays in the transmission of this virus of COVID-19. That means that distance is helpful, but may not be enough. 2 meters, which we've heard throughout the pandemic, 2 meters or 6 feet, is ultimately an arbitrary cutoff, and it's helpful. But what I want to encourage people to think about is that distance is good, more distance is better. Just because you're 2 meters and a hair away from somebody does not protect you. Rather than thinking about droplets and a cough being transmitted and being able to infect somebody, you should be thinking more like the impact of smoke in a contained space, or maybe a less appropriate metaphor, a flatulence in a contained space. And that is how airborne transmission can happen and can play a role. It is a small but important component of the continued transmission of this virus in the pandemic. And that means that the air that we are breathing and air circulation and actions such as opening the windows, and if you are with guests or other people, even just 10 minutes every hour opening a window as much as you practically can in the Canadian winter is potentially influential, but also trying to think about gatherings and activities that we can do outside. I think this is great too for getting fresh air and physical activity. I know personally throughout the holidays, sometimes you feel cooped up, and getting out and walking is a great way to potentially reduce your risk if you are interacting with others, to spend time outdoors, maybe gather for a hot chocolate or something else at a distance manner outside, bundled up in your snowsuit rather than inside. These measures will be very important. And our team is currently working on communication to help you celebrate a safer holidays this year, because I know lots of people have questions and there's a lot of uncertainty around what to expect. I also want to touch on the fact that different people have different risk tolerances, and we really need to respect those. As a father of 2 children who are still too young to be eligible to be vaccinated, I am taking a lot of extra precaution and measures. One of the things that is important in those measures is the mask that you are choosing to wear. Many of us have gotten used to wearing a mask through the pandemic, something like this, a medical mask, but we know now that a more tightly fitting medical mask as opposed to a cloth mask, or even a respirator mask, can be more effective in preventing the spread of infections that are airborne transmitted. And so if you are particularly concerned, or if you're finding yourself in a particularly concerning situation, getting yourself something like an N95 or KN95 respirator, or at least a very well-fitting medical mask, is an important intervention. Earlier in the pandemic, we were very careful to reserve these for the frontline healthcare workers who needed them, but manufacturing and availability has changed. These are very affordable and available. So recognize that some people will have different perceptions around risks, and some people may have greater apprehension around activities. Please be respectful of those as you gather with people, and if somebody wants to remain in their mask, keeping it on, if somebody isn't comfortable eating, if somebody would prefer meeting outside, try to be respectful to those. Holidays should be a time for cheer and for warm wishes for friends and family, and not for judgment. Respect for people's different tolerance for risk and their willingness to engage in activities is important. So again, we will be coming up with a series of guidance and communication information on how to celebrate the holidays safely in the coming weeks. So please follow us for more details. I want to speak briefly about COVID-19 in schools, because we are seeing more transmission in schools, and that is concerning. It's really important that people continue their daily symptom screen. And if you're ill, even if it's only one of the COVID-19 symptoms or not a listed symptom, please stay home. We are seeing people who are going to work with runny noses, with coughs, and this is a very good way to transmit the virus and a very bad way to help us combat this pandemic. Testing is also extremely important, so please do seek testing if you do qualify. And we will have information being distributed to families of school children who will be receiving one of these rapid antigen take-home kits. And this will be a very important tool to help us get back to a safer January, so that you can complete testing with your children at home. And if there are cases of COVID, we can detect them before they come back and before they spread in the schools in the new year. I really hope that we continue to see cases decrease in this school population as 5 to 11 vaccinations increase. But please don't wait, vaccinate. It is so critical for us to increase the coverage in this population. I have heard of many people hesitant, but leading into the holidays especially, if you are going to have your child vaccinated, and I strongly encourage you to do so, please do it as soon as possible, because that will be very important in helping us to get some coverage and then full coverage in the new year when second doses come around. And this is really critical right now. So I can't stress that enough. We already have 2,300 children booked waiting to receive their first dose, and we're adding more appointments daily. So please do come forward. I want to end on a more somber note, which is that it has been very disheartening since arriving to hear of challenges that some of our staff have been experiencing at vaccination sites and in other work that we are trying to do to protect the safety of our population. The work our staff have been doing for nearly 2 years now has been tireless. It's often been thankless. And now I'm incredibly discouraged to hear about threats to our staff's safety. While I want to recognize that everyone has the right to free speech and to protest in Canada, in our country, these cannot be allowed to compromise our staff's safety or our response to the ongoing pandemic. Appropriate ways of protesting cannot infringe on the rights of 5-year-old children to be vaccinated. There is no excuse to intimidate our staff who are just trying to help community members. We have had lots of negativity, but we have also received encouraging words, and I want to say that they are deeply appreciated. And we'd love to see more. I have only been here a couple of days, so I will take no thanks or greetings personally, but I know the staff would love to see if you've had good experiences or you want to send an encouraging word. Please, 185 King Street is our address, and we'd be happy to receive and share with our staff thank you cards, holiday greeting cards, whatever it is that you would like to share to help to positively encourage our staff in the great work they're doing, I think will go a long way. So that's all I want to say for now. Happy early holidays. I'm looking forward to talking to you all much more in the near future and for questions today. So thank you very much, and I'll turn it back to you, Brittany.
That's great. Thank you very, very much, Dr. Pigott. Okay, so let's, I believe Mayor Therrien has joined us and has a few words to share. So if you'd like to go ahead there, Mayor Therrien, and then we'll move on to the media questions. Go right ahead.
Thank you so much, Brittany, and sorry that I was late and missed my colleagues welcoming Dr. Pigott. It's so great to see you. I know that I saw it on your Twitter the other day, and it made me realize that I need to get my winter bike up and running. So welcome to the community. I know that on behalf of my colleagues, Chief Carr and Weetung and Warden Jones and Mayor Mitchell, you got an extensive welcome. And just on behalf of City Council and the City of Peterborough and all its residents, we just wanted to extend that as well. We're very excited to have you here and to hope that you're fitting in well. And just wanted to echo some of the comments that you made. Certainly the behavior that we're seeing from some folks around vaccination clinics and towards public health staff is unacceptable and something that I've been speaking strongly against for many months. We know that we need to keep being vigilant as we're heading into the holidays, and as you talked about, everybody has different risk thresholds. A lot of people also have underlying conditions that might not be obvious to you, and or they deal with people in their lives, loved ones, and are caregivers for people that have underlying conditions. So we just reiterate to encourage that patience, that understanding. Not everybody has the same threshold for risk that you might. So it's really important to keep that in mind and to be patient and to do everything that you can to help us move through this pandemic. I know it's not what any of us wanted, but it's what we have, and we have to deal with it. So yeah, I just wanted to say thank you, to say welcome. Looking forward to working with you going forward. I know that we're meeting on Monday. I'm looking forward to that. And I'll be on the line if there are other questions. So thank you very much.
Super. Thank you very much, Mayor Therrien. Okay, so let's, well, Dr. Piggott, if you can just stay on the screen there, and then I will invite our media guests to ask a few questions. And I'm going to start with Matt Latour, who's joining us from some of our local radio stations, the Oldies and Freak Radio. So if you've got some questions for Dr. Piggott, please go ahead. Oh, sorry, and before we get underway, I should mention we have some of our enforcement partners on the line joining us as well. We have Inspector John Lyons from the Peterborough Police, as well as Constable Joe Ayotte from the OPP, and Julie Ingram is also here with us from our enforcement and inspection team. So go ahead, Matt, if you've got some questions.
Perfect. My first question is for Dr. Piggott. It has to do with booster shots of the vaccine. I know there's a lot of talk that the Ontario government will announce today that anybody 50 and up can book their booster shots. Do you think going by age is the right approach, or should it go by when your second shot was?
Thank you for the question. I think that the provincial government and the federal government and their technical advisory groups are providing great advice that is being followed throughout this pandemic. And I do believe that the approach of continuing to try to best protect the highest risk individuals is important. We've done that so far with third doses for healthcare workers, for example, and I do believe this is the next logical step, and we are waiting and ready to support around this next phase for sure.
When it comes to the vaccination rates, I know you mentioned we're about 85% for people eligible 12 and up right now, but you'd like to see that, closer to an A+. Actually, I like the way you put that. Do you think something like incentives like we're seeing down in the States would be able to help with this, or do you think it's just kind of, staying the course right now and we'll get there?
I think there's been mixed evidence on those. I think that we need to stay the course. I think that we need to keep communicating and encouraging people. I think it's very important for us, my whole team, to take an open approach to helping to address questions and convey evidence and information. But I think we all have a role to play too. And, if you're vaccinated, but you're talking on the phone with a family member who's hesitant or has questions, directing them towards important evidence or information is really useful and important. We all have a role to play in this to get us up to the A+. It's a group project, if you will.
Perfect. And my next couple questions were for Julie Ingram. I think, Brittany, you mentioned she's on as well?
Yes, I believe she is. So let me just spotlight her as well. Go. Thank you, Julie.
Yeah.
Perfect. So my question had to do with some of the Section 22s that we've seen issued. I know Peterburger's had one as well as Whitehouse, but one of them mentioned to comply or be shut down, and then the other one was just, it seemed like a straight shutdown. What were the differences in those scenarios?
Yeah, thanks for the question, Matt. I can say that the one that required to shut down immediately, there was it was necessary to take that route because there was a greater risk in that environment given the extent of non-compliance that we were seeing, and primarily related to the overcrowding and overcapacity of the facility, as well as the nature of activities taking place in the facility. It is operating as a dance club, so it is subject to more strict capacity limits, and those weren't being followed. When there is dancing, it's a close environment. There is no physical distancing. While there should be, masks are often removed because people are eating or drinking in the environment. There's a lot of exertion and heavy breathing. So due to the risk of the environment itself, that's the reason that decision was made for the Section 22 order.
And when you look at somewhere like Peterburgers, there's been, we've seen a large amount of protesters there, and it seems like people camped out as well. Does that make it more difficult for public health enforcement when they go to issue these orders?
Regardless of the nature of what's happening at the establishment, we do everything that we need to do to protect our community. And that involves relying on other enforcement partners, such as Peterborough Police Service locally. So I would say, while it presents different challenges, we do what we have to do, and it doesn't make it more difficult, so to speak.
And my final question is, outside of, these few cases where we have seen the non-compliance, is it safe to say that for the most part, businesses and more so restaurants in Peterborough have been pretty compliant?
I'm so grateful to the majority of our business owners in the city and our restaurant operators, because I'm so pleased to be able to say that, yes, the majority are compliant. They continue to be compliant. They want to protect the community and do the right thing. So as I've said before, I extend my gratitude to most of our business owners. And for those who are not compliant, we're taking it seriously.
Perfect. And I thought of one more question during that answer, so I'll ask that too. I know that there is the app that businesses can download to check the QR codes, but it seems like every time I go, they just kind of do the visual check. That app, correct me if I'm wrong, it's not mandatory, correct?
That is correct. The app is not mandatory to be used by establishments.
Do you know why? Maybe it's just the places I'm going, but maybe why it's a little bit slower to catch on?
I don't really have a comment to that, to be honest. We have been promoting that app as well, but it's ultimately the operations of the business. Might be a good question to ask, like the local Chamber of Commerce or the BIA or something along those lines.
Perfect. Julie, Dr. Piggott, thank you both.
Thanks, Matt.
Thank you very much, Matt. Okay, I'm going to invite Paul Rellinger, who's joining us from Kawartha now. And Paul, welcome. If you've got some questions for let's start with Dr. Piggott, and then we can move on a few of other questions. Go right ahead.
I do, and thank you, Brittany, and welcome, Dr. Piggott. It's great to have you here and settled in. Just a couple of things for clarification, mostly. When you were talking about the outbreaks, I just want to clarify where those are. I believe there's two, and I'm thinking it's Rima Christian School and Holy Cross. Is that correct?
Yeah, thanks for the question. I'll turn to Donna, who's on with us, who I think can best clarify that.
Hi, Paul. Yes, you are right on the money. It is both Rima Christian School and Holy Cross Secondary School. There was a previous one that was closed yesterday. So we currently have the two schools who are in outbreak.
Right, and both schools are open, but with additional measures in place, correct?
Rima Christian School, I believe, is operating online at this point. So they're not providing in-person education.
Okay, perfect. Thanks so much, Don. I appreciate that. For Dr. Piggott, just following up on Matt's question regarding the booster age group being lowered potentially down to 50. As you said, you're waiting for word on that. Everybody's anticipating an announcement at some point, possibly as late as or as early as tomorrow. I'm just trying to get a sense of how quick we're ready to move to accommodate that bigger age group here. Is everything kind of on go? Is that a transition that you don't anticipate will? Because it is that's a lot of people, right?
Yeah, no, thank you for that question. I think it's best to wait until the announcement for context and details. What I will generally say is that the team is constantly planning and constantly anticipating the next step to ensure that we're always hitting the ground running any next step in this campaign.
Great, thank you. And then just one more thing, and not to kind of beat it to death, but the threats that you mentioned is very disturbing. Are they a combination of in-person threats, phone threats, emailed threats, or are we talking like quite a number of these on a regular basis?
I think because of the nature and sensitivity of that, I'm unable to comment on particulars. But any is disheartening to me. It's certainly not a large number of people or a important minority of our population. We know that 90% of people have been vaccinated. It means 9 in 10 people are very supportive of that and of the work we're doing, and maybe others as well. It's a small minority that is responsible around this. And we are taking this extremely seriously, and certainly any threats against safety, we will be collaborating with police and ensuring that it's investigated to the full extent of the law. But I just want to reiterate that I stand in front of our staff for the safety of the work they're doing and the broader healthcare workers. This is not just Peterborough Public Health staff. Other healthcare workers in our region and elsewhere are experiencing this, and I have zero tolerance for this. We are tired. We have been working tirelessly for nearly 2 years on this pandemic, and this is the last thing we need now as we're continuing this work and continuing the work of protecting the population.
Thanks so much, Dr. Piggott. I appreciate that. And I had one question for Julie, if she's still on the line.
I'm here.
Hi, Julie. Yeah, just going back to the cease and desist order, I guess that was issued to Peter Burgers. When, and this is going to sound kind of crass, maybe, and a little direct, but when is enough with this business? I mean, this has been going on for, it seems, weeks, and you guys issue fines and notices, and you're doing all the right things, but they're clearly being ignored, ripped up, thrown in the garbage, whatever. And, I guess the main concern is the message that sends, right? I mean, the defiance. And so I know you can't really kind of lay out all your cards on the table as to what might possibly be next, but you must be close. It's got to be very frustrating, and more action is possibly coming there.
Paul, I appreciate your comments, and I agree with many of them. It's frustrating for anybody involved, as well as our community. I know the community's been watching events transpire, and we've been receiving a lot of calls. I can't say much on the matter at this point. What I can say is that there are processes that need to be followed, and we will take any action that we need to take. But unfortunately, I do have to leave my comments there.
Fair enough. Thank you, Julie. I appreciate it. Thank you so much, Dr. Piggott. And back over to you, Brittany.
Great. Thank you so much, Paul, for those questions. And I will just remind our viewers as well, when it comes to booster shots, that our pharmacies are also offering those. So they'll be an important part of the strategy if there is any expansion announced. Okay, let's hear from Reg Watson, who's joining us from the Peterborough Examiner. If you've got some questions for Dr. Piggott, please go right ahead.
Just a quick question, follow-up question for Julie. Just since Peter Burgers continues to operate, does that mean that it is now in compliance with requirements?
The investigation continues, but at this point, I can't say much more about it.
Okay, thank you. I'll turn it over to Bill Hodgins, my colleague.
Thanks, Reg.
Okay, go ahead, Bill, if you've got some questions, and just for Dr. Piggott's background. So Bill's joining us from Peterborough This Week, which is a sister paper to Peterborough Examiner. Go ahead, Bill.
Hi, Dr. Piggott. Couple of questions, and just a short one, following up on the boosters again for the 50 plus. You talked about planning ahead. If the volume is there, will it be expanded, do you believe, to walk-in clinics, or will people still need to register through the provincial site?
I think we will get information as the release comes out with that direction. And certainly if there's any local clarification needed, we'll be adding that immediately after.
Okay, and the second question for you, it's not so related, but coming to Peterborough from where you were there any sort of regulations, rules, trends that you found worked well in your previous position that you think would benefit Peterborough that they're not doing here?
I think it will be a two-way street of learning, or two-way bike lane, maybe I should say, of learning. A context and experience that I had in Labrador was an excellent environment and experience. We had really strong partnership with 4 Indigenous partners in that region, and that partnership, including early sharing of information and a recognition of self-governance and autonomy in decision-making for our Indigenous partners was really critical to what I think was a very successful pandemic response. There still have been no cases of COVID-19, 0 cases of COVID-19 in our remote fly-in Indigenous communities. And that is thanks to a good collaborative working relationship, but also the leadership of Indigenous partners. I think that is learning that I can provide, though I do know there has been good, strong relationships with Indigenous partners here locally. I think that the context of COVID in Ontario is quite different than Newfoundland and Labrador, where a zero COVID approach centered around travel restrictions really decreased case numbers through a good component of the pandemic. And that is not the same context, obviously, in this province. But I think there will be lots of two-way learning, and already from our team, there's lots of wonderful things that I'm learning about. And I've got 2 ears, 1 mouth this week and next as I start out.
Excellent. And if I could just ask Julie a question too, if that's okay. Julie, are you there?
Hi, I'm back.
Hi. This may be out there and I just don't know, but opportunity to ask. With the White House situation, is it still closed? Was there a time limit on that closure? What is happening there now?
Yeah, I can give some information on that. The establishment has been compliant and they do remain closed. We are working with the establishment on their COVID plans to ensure that they are able to operate safely for their patrons in our community. So we will continue to work on that, and the order will be rescinded when we are satisfied with their plans.
Excellent. Thank you. That's all my questions.
Okay, great. Thank you both. And thank you, Bill. All right, let's hear from our global colleagues. So Jessica Nisnik is joining us from Global Peterborough TV. If you've got some questions for Dr. Pigott, please go right ahead.
Thank you, Brittany. I do. Hello, Dr. Pigott, and welcome to your first media briefing. I just had a couple questions. I think you said vax escape at one point, and I was hoping you could clarify what that means. Did you say vax escape?
I would have said vaccine escape, and thank you for asking for clarification. It's nothing to do with an escape room or a game or anything like that. It's the technical medical term that we use for when a virus is able to evade and isn't as effective with a vaccine. And the context of that comments was, at this stage, it's still all speculation with regards to the Omicron variant, but studies are ongoing and there's significant global attention to how protective the vaccine will be. We anticipate that there will be good protection. It may be less. I'll just take a brief moment to, reiterate. I know we've been with the COVID-19 vaccine for almost a year now, but it really is a medical science marvel. And it's incredible that in such a short period of time, it was developed and tested to all of the rigorous safety standards we would expect, and we had multiple vaccines that were incredibly effective, nearly twice as effective as the seasonal flu shot, which we know the seasonal flu shot still is important and saves lives. So regardless, the vaccine will continue to be important. We're waiting for more evidence on what this new variant will mean. But that doesn't change the fact that if you have not had the chance to get vaccinated, or if you're eligible for a 3rd dose of this vaccine, please do so as soon as possible.
Thank you. And then just one other question. You held up a test kit for parents. how many kits will parents be getting? Is it just one? Is it one per kid?
My understanding, and Donna, correct me if I am wrong, is that one box of multiple test kits, I think there are 5 in the box, will be going to each household, along with guidance on how to use the test, as well as instructions on when these tests should be done so that it can be done in a way that decreases risk and catches potential cases before people go back to school in the new year. But I know that information is being shared with parents, and I've been keeping a close eye on this and instructing our teams that if we need to complement or help support, educate around some of the communications or information, we should be also adding to that. But I think that parents will be quite clear on how to do this and use this.
Okay, that's it for me. Thank you, Dr. Piggott. No questions for Julie on this end.
Okay, thank you very much, Jessica. I see there's another reporter from Global News Peterborough, and I'm sorry, I'm not sure who that is, but if you have any questions, please go ahead.
Oh, Brittany, we're testing we're testing something to see if we can record in another spot. So there's no questions there.
Oh, okay, great. Okay, good to know. I just didn't want to miss anybody. All right,
Thanks.
well then I believe that brings us to the end. We've heard from all of our reporters. So again, I just want to thank everybody for joining us. Thank you so much to our media guests for those good questions. Thank you to Dr. Piggott and Julie for so expertly in keeping our community informed, and to all of our leaders who were here today to join us in welcoming Dr. Piggott to the community. We'll see you back here on Thursday, December 16th. So do stay safe and take care, and we'll be in touch then. Thank you.
Thanks, Brittany.
Thank you.